Patient VM is a 53-year-old Pacific Islander male coming to Bape Clinic Pahoa on 10/5/2011 for diabetes management. I will be scoping his high triglyceride levels. History of his present illness: had elevated triglycerides first documented in 2010. Past medical history includes obesity, hyperlipidemia, metabolic syndrome, type 2 diabetes, bilateral carpal tunnel, and polyneuropathy. Family history includes paternal uncle who died of non-specified cancer and no family history of cardiovascular disease or diabetes mellitus type 2. Social history: smoking 1 pack of cigarettes per day for 20 years, 20-pack history, drinks about 12 cups of coffee per day. Diet includes mostly white rice, but has started realizing the impact on his blood sugar readings. Moderate exercise level, walks with grandchildren to the park. Describes feeling better when he increases his exercise. He also describes taking his medications at times. He states that taking fish oil on and off, as he has been getting it for free on occasion through insurance, but it's not always available to him. He does not take the Lovaza when he takes fish oil. He describes taking medicines in the morning before breakfast and describes taking 1 tablet of Lovaza twice daily and was confused about the prescribed dose. The immunization history is up to date. Review of systems includes negative for fatigue, fever, or night sweats, respiratory negative for cough and wheezing, cardiovascular negative for chest pain or irregular heartbeats or palpitations. GI is negative for abdominal pain, constipation, diarrhea, or vomiting. Physical exam includes height of 64 inches, weight of 211 pounds or 96 kilograms, blood pressure 126/80, heart rate 72, respiratory rate 18, temperature normal of 98 degrees, ideal body weight 59 kilograms, BMI is 36.2, BEE is 1839, and creatinine clearance is 123. Cholesterol labs from June of this year: total cholesterol 171, triglycerides 158, high density lipids 38, and LDL 101. Cholesterol labs from November of last year: total cholesterol 212, triglycerides 998, HDL 23, and an unreadable LDL. All other related labs are within normal range. Current medications include Gemfibrozil 600 milligrams by mouth 2 times per day for high triglycerides, Lovanza 1 gram by mouth 2 caplets twice per day for high triglycerides, fish oil 500 milligrams 1 tablet twice per day for high triglycerides, metformin for diabetes type 2, lisinopril for hypertension, aspirin for antiplatelet action, Neurontin for nerve pain, albuterol for asthma, Ultram for pain, and Lantus Solostar for type 2 diabetes. The risk factor for elevated triglyceride levels in all patients include obesity or being overweight, physical inactivity, cigarette smoking, a very high carb diet that includes more than 60% of your diet from carbs, insulin resistance or glucose intolerance, other diseases such as type 2 diabetes, chronic renal failure, or nephrotic syndrome, and drugs such as corticosteroids, beta blockers, estrogens, and genetic factors. The risk factors specific to VM include being obese, physical inactivity, cigarette smoking, very high carb diet, and insulin resistance. The Framingham risk score for VM is over 20% with an associated vascular age of over 80 years. The need for therapy in VM is required. His triglyceride levels are elevated over 400, which means that he is required treatment to reduce long-term complications such as myocardial infarction, angina, peripheral arterial disease, carotid artery disease, as stated by ATP3 guidelines. All of the drug information for VM's current regimen is taken from facts and comparisons. So Gemfibrozil 600 milligrams twice daily is a fibrate, is a first-line treatment for very high triglycerides over 500, and it is appropriate for VM as it has already significantly lowered his triglyceride levels. These have an ability to lower levels by 30 to 50%. He has no contraindications against using them and has had no side effects associated with their use, therefore it's appropriate. The dose of 600 milligrams twice daily is appropriate for VM. This is the maximum dose recommended. The oral route is appropriate. He has no problem swallowing these pills, and the interval and frequency of twice per day, 30 to 60 minutes before meals, is appropriate. There are no signs or symptoms of adverse effects of this drug in VM. The next drug, Lovaza, an omega-3 category, is 2 grams twice daily for a total of 4 grams, is appropriate in VM as his triglyceride levels have been lowered. ATP guidelines say that these can lower between 15 and 45%. He has no contraindications against using these and no reported side effects from this drug. The dose of 4 grams total is an appropriate dose as it is the usual dosage. The oral route is appropriate as he has no problem swallowing pills. The interval and frequency is appropriate as it can be given as a single daily dose or a divided twice daily dose. There are no signs or symptoms of adverse effects of this drug in VM. The last drug that he is currently taking for elevated triglycerides is fish oil, 500 milligrams twice daily. This is not appropriate specifically for VM as it is duplicating the Lovaza therapy and has been inconsistently available to VM due to his insurance. The dose of 500 milligrams twice daily is not appropriate as it should be 4 grams daily total dose. The oral route is appropriate and the interval and frequency is appropriate as it may be taken either once or twice daily. And there are no signs or symptoms of adverse effects from this drug in VM. Therapeutic alternatives. As there are only 3 categories for drugs specifically used to lower triglycerides, these 3 include the previously mentioned fibrates and the omega-3s. The one remaining alternative group is niacin. Niacin would not be an appropriate alternative for VM as it does not lower triglycerides as much as fibrates do or omega-3s do. There are no drugs in VM's regimen for which there is no therapeutic indication. And as far as interactions go, gemfibrozil may potentially reduce the efficacy of Lantus, although this has not been clearly established. Recommended treatments. I recommend continuing gemfibrozil as prescribed. I recommend continuing Lovaza as prescribed, along with patient education for proper dosing and adherence. I recommend discontinuing the fish oil as it is inconsistently available and it may be causing VM to be non-compliant with his Lovaza. I recommend lifestyle changes which would significantly reduce triglyceride levels and also as a dual purpose might act to modify his diabetes and metabolic syndrome. These lifestyle changes include smoking cessation, low-fat diet, exercise, and potentially weight loss of 10%. After changes have been made, including drugs and lifestyle modifications, triglyceride levels can be rechecked in 3 months. If it is still not controlled, his metabolic syndrome may need to be addressed. The drugs to avoid for VM include anything that will increase his triglyceride level. For the category of CHD risk equivalent, because he has diabetes, and also assuming that VM has atherogenic dyslipidemia. This is evidenced by the fact that he has metabolic syndrome and very low HDL and very high triglyceride levels. The goals stated by ATP3 guidelines include the following: LDL levels under 100, triglyceride levels under 30 over the LDL levels, and HDL level over 40. The focus should be on triglycerides since these levels are over 500. We can monitor the patient with cholesterol check in 3 months, And for gemfibrozil, we should monitor their patient for myopathy, elevated CK, and symptoms of gallstones, including jaundice. For patient education, VM, we are going to be making some changes to your medications that you take for your high triglyceride levels. Keep taking gemfibrozil as you have been taking it before, 600 milligrams by mouth twice daily, about 30 minutes to an hour before you eat. This is helping you control your triglyceride levels. You should store these in a cool, dry place, just like all of your other medications. If you miss a pill, you should take it as soon as you remember. The medicine may cause diarrhea, and it may also cause muscle pain. Be sure to tell your doctor if you experience any muscle pain. And although it's uncommon, this medicine can cause gallstones, so let your doctor know right away if you notice any yellowing of your skin or your eyes, or if you have any intense stomach or back pain. The Lovaza, 1 gram, should be taken as 2 pills twice a day. This means 4 pills total. You can take them by mouth, once in the morning and once in the evening as you've been taking them before. Take your Lovaza with food, and if you miss a dose, make sure to take the next dose as soon as you remember. You may have some diarrhea from this pill as well. Also, we are asking that you stop taking the fish oil. The Lovaza should give you the omega-3 fats that you need as long as you take the entire daily dose of Lovaza. You won't be able to tell if these medications are working, so it's very important to keep taking them regularly, and we will check your triglyceride levels in the clinic in 3 months to see for any changes. And there are also a lot of ways you can lower your triglycerides on top of the medications you take. Quitting smoking will help. You've mentioned trying to quit before. Would you be willing to try and do this again by the help of a patch? I'm giving you some information on this, and we can get you started if you'd like. Diet is another way that you can help reduce your triglyceride levels. One thing you mentioned was how much white rice you eat and also how it affects your blood sugar levels. Eating mostly carbs is one of the risk factors for getting high triglyceride levels. If you are able to reduce your rice intake by either having smaller portions or combining it with proteins and vegetables, this can help both your triglycerides and your blood sugar. You should also focus your diet on eating less fat. So I've printed out a handout for you to show you some low-fat options that you can have in your diet. Thanks.